Hello everyone, you're welcome to my living and coping video. I am Simbiat Lunge. This video is going to be focusing on a topic that is very relevant to everyone. I'm not just going to talk about women alone today. I'm going to be talking about something that is very relevant for everyone, for the male, the female, young and old, the elderly, and children. So please grab your chair and enjoy. I'm going to be talking about vitamin D deficiency. This is a very serious deficiency because lack of vitamin D can result to a host of health problems. Unfortunately, the symptoms may not be recognized for what it is, and the complications might have started before it gets diagnosed. Vitamin D is otherwise known as the sunshine vitamin. And what is the reason why? It's only because you can always get vitamin D from exposure to the sun. Aha! But unfortunately, not everyone can benefit from exposure to the sun. And the reason being that people who have dark skin have a lot of melanin in their skin, and this blocks the absorption of vitamin D from the sun. So that means people of African descent are very vulnerable to developing vitamin D deficiency. Before I go into the people who are vulnerable, I'm going to talk about the benefits of vitamin D. That way we'll appreciate why it is a very important vitamin. Vitamin D is very vital for the absorption of calcium, magnesium, and phosphate. And these minerals are very important for bone health. Vitamin D helps prevent rickets, especially in children. Vitamin D is also good for the support of the immune system, for lung function, for heart health, and very importantly, for regulating insulin in the body, which means it can help prevent type 1 and type 2 diabetes. And who are the people that are vulnerable to developing this deficiency? I've mentioned about people who have dark skin because of the melanin. Even if you don't have dark skin, but you stay indoors all the time, you don't get any sun exposure, there's a possibility that you will develop vitamin D deficiency. If you have milk allergies, that means you're not able to consume milk and not able to get the benefit of vitamin D from drinking milk. If your kidney is unable to convert vitamin D in your body, that means you might develop a deficiency. Also, if your digestive tract cannot absorb vitamin D, then you're in problem. And if you have obesity, yes, being overweight can make you develop vitamin D deficiency. Having talked about all these risks, let us talk about the symptoms, because it is important that you know what the symptoms are so that if you develop vitamin D deficiency, you can quickly get it treated. Before I go into the symptoms, I need to let you know that failure to get this deficiency treated, it can be very fatal. It can result in death, and it can even result into developing some cancers. So it is very important that you know what the symptoms are. Prevention is always better than cure. So try and prevent developing this deficiency. But if by one reason or the other you develop the deficiency, please get it treated. And what are the symptoms? If you start to have skin infections that don't go away, don't get easily treated, then you might be having vitamin D deficiency. If you feel tired and feel fatigued all the time with no reason, if you sleep well and you still feel tired, then you need to get yourself checked for vitamin D deficiency. If you have bone pains, joint pains, especially back pains that affect your functioning, you might be having vitamin D deficiency. Vitamin D deficiency can also cause depression. It can also prevent your wound from healing. So if you have a wound that won't heal on time, you might be having vitamin D deficiency. Bone loss is another symptom of vitamin D deficiency. Hair loss and also muscle pain. So all these symptoms are indicators for vitamin D deficiency. So please, if you have these symptoms, go and get your blood checked. Go to the doctor, get your blood checked. If you're having some unexplained symptoms and the doctor cannot even tell you what the reason are for you having these symptoms, there's a likelihood that you have vitamin D deficiency, especially if you fall into the risk group that I have mentioned. I'm going to go through them again because this is very important. If you have dark skin or are of African descent, if you don't get enough exposure to sun, talking about sun, early morning sun is good and late evening sun is good. If you have milk allergies, if you have kidney problem, if you have digestive tract problem, if you're obese, you are at risk of developing vitamin D deficiency. And for people of color, people who have dark skin, please get your blood checked for your levels, because when you check your levels, you're able to know whether you're deficient or not, because the symptoms will just creep in slowly, and there are a host of symptoms and you might mistake them for something different. So please get your bloods checked, get enough sun exposure, avoid the sunshine between 11 and 4 p.m. to avoid the ultraviolet rays. And most especially, if you wear sunblock all the time, you are at risk. Thank you very much for watching. If you have any question, please let me know. Put your comments on YouTube and I'll try my best to answer them for you. Thank you very much. See you again. Bye-bye.